Hello everyone, Namaskar. I am Dr. Damanjit Kaur. I am a consultant psychiatrist, Faith Hospital, Chandigarh. Today I am here to discuss about the thing which is there in each and everybody's life, that is coffee, or the alkaloid found or the substance found in it, that is caffeine. So I shall be discussing various facts and myths related to caffeine and how it affects our mental health. Once consumed in the form of tea or coffee, caffeine reaches to the bloodstream. From there, it gets absorbed from the gut and reaches to the liver, where it gets broken down into various compounds. These compounds reaches to the brain by crossing the blood-brain barrier, and it gets attached to the adenosine receptors. Adenosine is a neurochemical found in the brain that helps to relax the brain and make you feel tired and lethargic. So it blocks the effect of adenosine by getting blocked themselves on the receptors, thereby making you more awake and alert. They did not make you feel lethargic. Moreover, it also increases the blood adrenaline levels that again make you alert and awake. It is said that 1 cup of coffee can reach to the brain to show its effect as early as within 1 hour of its consumption. So, pros and cons of coffee is quietly debated. So, I shall be discussing how caffeine is related to the mental health issues. Number 1 is sleep. It is said that if taken even in small amounts, and if caffeine or coffee is taken near to the bedtime, it will interfere with the sleep, and nights of insomnia can lead on to the days of letharginess and tiredness thereafter. So one has to be very vigilant about it, that at least it should be a cup of coffee or a tea should be 6 to 8 hours before your routine bedtime. Second is mood disorder or change in the mood. Since I have already told that caffeine blocks the letharginess and tiredness, and it brings out change in the mood in the way it brings the alertness level, and also it can lead on to more of energy and upliftment of mood. But on the contrary, when you suddenly or abruptly quit coffee intake, it can lead again to low mood, that is sadness, or decrease in energy and tiredness can come in. Also, caffeine increases the adrenaline levels that leads on to the anxiety, jitterness or irritability if caffeine is taken in moderate to high amounts in a day. The caffeine intake can bring on to the levels that can mimic the symptoms of anxiety and panic symptoms. Also, heightened anxiety, which can be produced by caffeine intake, can also mimic, or it will interfere in diagnosing mania episodes with bipolar disorder patients. When we talk about caffeine, we also talk about our working memory or concentration. Yes, caffeine studies have reported that it has improved the working memory if a caffeine intake has been taken as much as 80 milligrams per day. Another study has reported that it's a good protective factor in case with patients of dementia in women over 65 years of age. Another study also has reported that the second cup of coffee will have no effect unless it is taken at least 8 hours after the first cup of coffee. Next issue which I will be discussing is that coffee is related to the headache. When we have a coffee withdrawal or a caffeine withdrawal, we generally have headache. Why? Because caffeine can lead to vasoconstriction, that is the constriction of the blood vessels. It decreases the blood flow that helps in resolving the headaches, but in caffeine withdrawal there is again dilatation of blood vessels leading on to the increased blood flow, which leads to the throbbing type of headache, and in fact it can also precipitate migrainous headache. What is caffeine withdrawal? I shall be discussing this. when we abruptly discontinue with caffeine intake, it can lead to symptoms of jitteriness, anxiety, irritability, letharginess and headache. So this is known as caffeine withdrawal, and it can start as early as 12 to 24 hours from the last intake of caffeine, and it can last up to 9 days. So how to cope up with it? Number one is one should have gradual tapering down of the caffeine intake. We can slowly or decrease the number of teaspoons used in cup of coffee, or we can gradually replace them with decaffeinated coffee. It has been seen that if the gradual reduction is for at least 6 weeks, it shows successful cessation of caffeine intake with minimum side effects. Number two, so it's very important to stay hydrated. That will help you to take care of your fatigue and headache. Number three is take adequate sleep. At least 8 to 9 hours of sleep will be helpful to overcome this fatigueness and letharginess. Next very important fact is how much caffeine is too much of caffeine. DSM-5 has recommended that taking coffee in moderation is advisable for a good healthy lifestyle, but 300 to 400 milligrams per day, that makes 5 cups of coffee, is too much of caffeine for a person. In pregnancy or women who are planning for pregnancy, it is recommended that they should not exceed their caffeine intake to more than 200 milligrams per day. Pediatricians are totally against caffeine exposure to the children below 12 years, and in fact for 12 to 18 years it is advisable that it should be up to 100 milligrams per day. I have discussed about the related mental health issues, but there are some positive effects of caffeine as well. Number one is that it is good for keeping up to the healthy liver, skin and digestive tract. Also, if we take a cup of coffee 1 hour before our exercise or workout in the morning, it improves our performance. So it is really helpful for this purpose as well. Lastly, I will to sum up is that use coffee within the advisable safe guidelines, number one, and don't be afraid to cut back or cut down the coffee intake. Every time is the right time to cut down coffee intake if you are taking coffee in moderate to severe consumption. So it's any time is the right time. Have a great day. Thank you.